One of the most common questions I get is on bioidentical hormone therapy. Is it safe? Should I take it? Do you prescribe it? And so I'm gonna break these things down in today's video. And also, this is a topic I personally care very deeply about. There are so many myths and misconceptions about bioidentical hormone therapy, and it is extremely harmful to women when we sell them something that is not regulated and not safe. So that's what we're going to be talking about today. If you want to know if you should take it, if it's safe, and if I prescribe it, then definitely stick around for today's video. If you guys don't already know me, hi, I'm Dr. Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts, where I see patients on a consultative basis for menopause. And there we discuss all things perimenopause, hormones, and menopause related, as well as bone health, sexual health, breast health. So if you'd like to see me to get one-on-one personalized medical advice, I will drop in the description bar below the number to my clinic where you can call to see if you could be a patient of mine. I also created my course, The Complete Guide to Menopause, everything you ever wanted to know that your doctor never told you. If you really wanted to see me, but you just don't live in the Northeast, or it's just not feasible to travel, because I want this information to be accessible to everyone who wants to learn about it. I will drop the course link in the description bar below as well. I am also faculty at Harvard Medical School and so excited that I get to teach the upcoming medical students and residents and doctors in training about all things menopause and midlife. Actually, as of the filming this video, as of today, when I'm filming this video, the New York Times just came out with a really nice article that was quoted by Dr. Stephanie Fabian, who is the medical director for the North American Menopause Society. And in it, she talked about the fact that there is only about 750 North American menopause certified physicians across the country. I will drop the link to that article down below. And also, if you want to see a NAMS doctor, you want to go to menopause.org. You're going to go to that website where you can search for a provider by zip code. If you can't see me and you live in there, when you go to menopause.org, you can search under find a provider and find someone who is close to you. Also, there is a ton of new stuff that I'm working on that is top secret, but if you want first dibs on knowing what these are, you have to definitely sign up for my email list. You can do that below. Also in the description bar, everything should be there where it says get your free hormone health guide or menopause guide. Click that link, you'll get the free guide, and you will also be on the email list where you get to know what else is happening in this menopause community that we are building, and you get to know it first. Okay, if you've watched any of my videos before, then you know I like to break things down into 3 points. And that's exactly what we're going to do in today's video. Number 1, what exactly is bioidentical hormone therapy? And a PS, it's probably not what you think. Number 2, is bioidentical hormone therapy safe? And number 3, what do I recommend to my patients? Before we get into that, as always, comment below if you find the term bioidentical hormone therapy confusing, or if you've spent countless hours on the internet trying to figure out what bioidentical hormone therapy is or is not. And tell me also in those comments what else you want to learn about bioidentical hormone therapy after you watch this whole video. Without further ado, let's talk about point number 1. What the heck is bioidentical hormone therapy? Well, I'm going to make this really easy. Bioidentical hormone therapy means estradiol. Estradiol is a prescription strength of estrogen. Unfortunately, the term itself is extremely misleading. You think bioidentical, identical just gives you imagery of it's identical to me or it's identical to what I need, or it's the right mixture of estrogen, progesterone, testosterone that I need. No, it's not. That's not what it means at all. But that marketing term is key. If that's what you thought it was, that's what they're trying to get your brain to think that it is, because doesn't that sound wonderful? It's exactly what I need. It's customized to me. They've used all these labs to find out what exactly I need. Well, I wish that were true, and I hate to be the one to burst your bubble, but it's not. No matter what they're telling you, bioidentical simply means they're using a more synthetic or plant-based version of the prescription strength of estradiol, which is estradiol. So say it with me. Bioidentical means estradiol. Now, it's an umbrella term. It's a slang term. It's not really a medical term, so it can also encompass some of the other more natural types of hormone therapy, such as micronized natural progesterone can also be considered bioidentical. Again, it is not identical to you. The dose is not identical to what you need. Sorry. I know you've got to learn that main point is that bioidentical does not mean it's identical to you. I also don't really love the term body identical. That also just invokes images of exactly what you need we're replacing. It simply means it is estradiol, and it can also mean it's micronized natural progesterone. Now, the reason bioidentical became very popular was because in the early 2000s, when the women's health study came out, a lot of people became scared of the more man-made estrogen and progesterones. These are also known as conjugated equine estrogens, aka Premarin, which comes from horse's urine, and more man-made types of progesterone like Megase or medroxyprogesterone acetate or MPA. Those were the medications that were used in the WHI. So specifically in the WHI, they used Premarin for women who had a hysterectomy and Prempro for women who had an intact uterus, which is a Premarin plus, and progesterone, the MPA arm. Now, we've talked a lot about the WHI, and actually I have several videos, and I'll link one here on the safety and efficacy of hormone therapy because it's actually much, much safer. And I also did a whole podcast episode on the WHI, which I will link below because that is a great episode to really break down what the WHI taught us. It wasn't a bad or evil study. It's just that it was not a study designed to look at treating hot flashes. It was a study looking at using estrogen to prevent heart disease, and also there was a much older cohort of women in the WHI. So definitely check out that podcast and also my video I did on the safety of hormone therapy. Because that study scared a lot of people, this term bioidentical or this wellness sort of business started to boom. This billion-dollar industry selling you bioidentical hormones. So bioidentical simply means estradiol, okay? Now, this is what I want you to ask yourself. Is my estradiol FDA approved or not FDA approved? Because that's going to get into point number 2, which is bioidentical hormone therapy safe? The answer to this is it's particularly safe if it's in the FDA approved camp. Now, there are lots of people who want you to think that commercial medications or commercially produced medications are dangerous or harmful, but in fact, in the WHI, Premarin actually had a significant amount of safety data. In fact, all the data that we get and we extrapolate to estradiol actually comes from the data on Premarin. So before you go knocking Premarin, we actually learned that it's actually particularly safe. We actually definitely use a lot of bioidentical hormone therapy and also consider them quite safe because they have a lot of similar properties as Premarin, but you want to make sure that your estradiol product is FDA approved. There are numerous reasons that you do not want to use compounded non-FDA approved hormone therapy. So let's make this distinction really, really clear. There is estradiol that's FDA approved. That means you can get it at CVS, Walgreens, Kroger, wherever your grocery store is or wherever you commercially get products, you can get FDA approved estradiol. Then there is compounded non-FDA approved estrogen, progesterone, and testosterone combinations. Typically, these do not come from Walgreens or CVS. They have to come from specialty pharmacies, and these are what are considered not safe by most NAMS or North American Menopause certified physicians. Now, the one caveat is I have a few, and I can count on probably one hand, maybe the other. I have a few patients who have to use compound non-FDA approved because of severe allergies or reactions to almost every commercial available product, but it is very, very small. So if I say on both hands, and I have seen hundreds, if not thousands of patients, it is an extremely small number of women who need compounded non-FDA approved bioidenticals, usually because of some type of allergy that is in whatever the estrogen is packaged in. So you might be saying to yourself, well, Dr. Hirsch, what are the dangers? Because I have heard constantly that these are safer, that these are better, that these are bioidentical, these are identical to me. Well, we already talked about that point. Non-FDA approved compounded hormone therapy is not regulated. It is an unregulated industry. So every single prescription that you get is slightly different. You don't know exactly what is in each of those, and so it's not regulated. A lot of women are horrified and surprised to learn that the bioidentical hormone therapy industry is not regulated. There is no overseeing governing body. Number two, because they are not regulated, you cannot study these very well. You cannot study them in a clinical trial. You cannot put them head to head with, FDA approved estradiol or Premarin, because each preparation is slightly different. So these are just not well studied. That means that you're just pretty much taking a gamble on something that, number three, is usually extremely expensive. Extremely expensive. I typically find compounded medications of estradiol are, let's say $50 to $100 a month, where I could get you the exact same FDA approved estradiol and micronized progesterone for just a couple of bucks a month. Yeah, and it's pretty much the same thing, and this is much safer. It's regulated and it's been studied in clinical trials. Personally, I find this financial burden to be nothing short of abusive. I think it is taking advantage of women when they are at their weakest, when they feel discouraged, and when they don't feel like themselves. If they're flashing, if their hair is falling out, if their sex life is going down the tubes, we would all pay whatever amount of money we needed to get those things to be improved. But this industry is making you think that you have to spend so much money for these products which are safer and better, and I am here to tell you that is simply not true. Because they are unregulated and because they are not governed, there are some safety issues with these medications. Now, I did a whole video on testosterone pellets that can also be included in what I'm talking about here in this unregulated, non-FDA approved. So definitely watch that video on testosterone and when it's in pellets and why I do not recommend them. But the safety data is clear. First and foremost, this can increase your risk for uterine cancer because the balance of estrogen and progesterone are not great. They're kind of gambling, they're kind of guessing, and each dose is a little bit different. So because these also haven't been studied, there is no good data to show that this is going to prevent you or keep you from getting uterine cancer. Now, if you don't have a uterus, of course, you still won't get uterine cancer, but this is a really big thing. And yes, I have seen uterine cancer from women who have been on unregulated, un-FDA approved compounded hormone therapy. Second, when you're using a compounded cream, say it's combined estradiol, progesterone, maybe even testosterone, we know that progesterone doesn't get absorbed particularly well through the skin. So that is definitely going to create a really bad imbalance of your estrogen and progesterone. So when you have too much estrogen and not enough progesterone, that can lead to an increased risk of uterine cancer. Now, other things that can happen is when you get super therapeutic levels of testosterone, so sky high levels of testosterone, you can get all sorts of really dangerous and not only dangerous, but permanent side effects, including loss of hair, which nobody wants in menopause, permanent deepening of your voice, and permanent enlargement of your clitoris, or acne that can be so bad that can leave scarring for a really long time. So because these are unregulated and because there's no good way to know what's getting absorbed in which ratio, they are extremely dangerous. So I always say that you're basically a guinea pig for this industry. You're a guinea pig financially and you're a guinea pig medically. And I want you to be stronger than that. And that is one of the big reasons I became a menopause doctor, was to dispel this myth so that women do not get taken advantage of at a point when they are particularly vulnerable. And so lastly, on to point number 3, do I prescribe bioidentical hormone therapy? Well, yes, I do. I do every day. I do it all the time, but I only prescribe FDA approved bioidentical hormone therapy. And again, what does that mean? It means estradiol. Say it really loud with me. Bioidentical means estradiol, and you want to make sure that it is FDA approved. So, you know, a lot of times you DM me or you send me questions and you send me what you're on, and it's sometimes hard to tell because if we're using generic names versus brand names, but if it's estradiol, you always want to make sure it's FDA approved, and that means, you know, you got it at a pharmacy where commercially available FDA products are usually picked up, CVS, Walgreens, etc. And you do not need to specifically go to a compounding pharmacy to get your medication. So here's some examples. Oral estradiol, that's just estradiol, and that's bioidentical. Estradiol comes in the patch form, that's bioidentical. And then if you have a uterus, I'll prescribe micronized natural progesterone with those combinations. There's also a combination tab called Bijuvia, which is estradiol, micronized natural progesterone together. Even something like Divigel, that's bioidentical, it's just estradiol. So there is lots of ways that I prescribe bioidentical hormone therapy that are safe. Now, do I still prescribe Premarin? Yeah, I do. Again, a lot of the safety data we have comes from Premarin, and some women simply don't mind where it comes from. Some women, you know, in the comments, I know are going to leave very strong opinions about Premarin, yes or no. But again, we shouldn't shame each other really for what we're using, because they are still products that are in the repertoire that I can prescribe. And sometimes it comes down to what your insurance will let you get. For whatever reason, some insurance will cover X, Y, and Z, and some insurance will cover, you know, A, B, and C. And so that's another reason we have to either look at Premarin versus estradiol. So yes, I definitely do prescribe them. Now that you guys know a little bit more about the differences between bioidentical hormone therapy, conjugated equine estrogen, and what I prescribe, if you want a deeper dive, again, check out my course. And I also have a mini course just on hormone therapy, so I'll link that as well below if you just want the section about this on hormone therapy. And I really spend a big chunk of time going over all the myths and misconceptions about the different types of hormone therapy. And, you know, a separate topic is also testosterone, because testosterone is not an FDA approved product in the United States, and we could do a whole nother video on that. Please feel free to leave more questions in comments in the comment section below. And if you like this video, please send it to a friend. Please post it on your social media, on your Instagram, because this community here is really, really growing. I highly encourage you to click the subscribe button, because that is telling YouTube that this is the premier place to get, you know, updates on menopause, perimenopause, hormone therapy, and everything else in between on YouTube and just in general. So thank you so much for supporting the channel. It's actually, well, of course it's great for me, but it's also really helping other women get the right evidence-based information that they need also. And I also have many clinicians, residents, medical students, and doctors who are already working and out there in the field who watch this channel. So it is just a really wonderful thing to see this community grow. It makes me so motivated to continue to get videos out to you. So new videos come out every Friday. So please give this video a big like, share it on your social media, send it to a friend, encourage them to join and subscribe. I will see you guys again next Friday for a brand new video. Again, follow me over on Instagram. I'm at hormone.health.doc, where I let you weigh in and suggest a lot of these topics. I'll see you guys next Friday. Thanks so much for watching. Bye, everyone.